Okay, we're going to talk a little growth and development about toddlers, which is age range 1 to 3. Created a nice little timeline here for you, which we'll come back to. We'll start with growth. So blood pressure will slightly increase during this time frame up to 99/64. Weight, height, and head circumference will continue to grow. However, the amount that they grow in these three areas is much less than they did in the infant time frame. Respirations will slow slightly. Normal range is still considered from 20 to 30. Heart rate slows from 90 to 1, normal is considered 90 to 110. And at this time we can start calculating BMIs on children in between the ages of 1 and 3. So for our timeline, starting around 1 year of age, Erickson's theory is now autonomy versus shame and doubt. So we want to give toddlers as much independence as we can while maintaining rules and guidelines so we can maintain their safety. We're still using the FLACC pain scale, which is gives the toddler a pain number based upon observations that we're making. Toddlers tend to be fussy eaters. It's part of that, obtaining that independence. They like to be in charge. They tend to resist bedtime. They are egocentric. It's all about them and, gaining that independence. They play, but it's considered parallel play. So infant was solitary play, and this is parallel play. So they'll play next to another toddler, but they will not play with them. Brushing and flossing is to be done by an adult caregiver, not the child themselves in the toddler years. Around 15 months, they tend to hold a spoon, but it will be upside down in their mouth. So they'll probably want to try to feed themselves, they just don't know how effective they're going to be. And they should walk well alone without assistance. Moving on to 18 months, I stuck this here so the anterior fontanelle closes in between 12 and 18 months. So by 18 months of age, that soft spot, that big one, diamond-shaped one in the front, should be closed by 18 months of age. Head and chest circumference should be equal. This can happen as early as 1 year, or it could take all the way up to 2 years of age. Head and chest circumference are equal. Again, we're still on 18 months. They should hold spoon correct so they can start begin to feed themselves. They can run and jump in place. They can name one body part, and they can walk stairs, but they tend to take them one at a time, put both feet on them, and then go to the next one, and they need assistance doing that. 24 months of age, it's okay to switch from whole milk to low-fat milk. They can open doors, turn doorknobs and open doors, so we're worried about safety there. They can unscrew lids, poison safety. Now they can climb stairs alone, even though they're taking it one stair at a time, both feet on one stair and then to the next. 30 months of age. They can start to draw simple lines with a pencil. They should know their full name. They're able to name one color. They can hold their fingers up to show you how old they are. Of course, they're not going to hold 30 fingers up, but they'll probably hold 3. Again, egocentric. 36 months or 3 years of age. Gender identity is achieved by 3 years of age. A little bit later when we talk about differences in male and female genitalia and when that starts to get noticed, if there's anything that's abnormal, they like to correct those before 3 years of age because that's when the child starts to notice that. It's recommended that you can start potty training at this time. They should have a 300-word vocab, and toddlers like to use the word no. They should sleep 11 to 12 hours at a time, get one nap during the day, and again, bedtime resistance is very common in the toddler years. It's all about them, egocentric and wanting to gain that independence, dress themselves even though they look not too well. Toddlers start to demonstrate memory, and this is no specific spot on the timeline, so this is in between 1 and 3 years of age. They start to do domestic mimicry, so whatever they see the same-sex parent doing, they may role play that, such as playing house. Toddlers are unable to see others' points of view, part of that being egocentric. Appropriate play toys, large puzzles, such as the one here. Blocks, still blocks, just like in the later infant stage. Push-pull toys, so I got a chair, but the toys that make lots of noise that they can push-pull, vacuums, or toy vacuums. They like to toss balls. Thick crayons, you don't want to get the small ones because they could accidentally swallow those. And they like to fill empty containers, empty boxes with stuff, and then take it back out. And books to look at, so bright colors, large pictures type thing, because they're not reading yet, but they can look at books. Let's see if there's anything else we want to mention. Intranasal meds are not recommended if the child is less than 18 months of age. So no intranasal meds less than 18 months. Watch for choking hazards, finger food such as popcorn, again grapes, anything, hot dogs, anything that's smaller than that toilet paper roll that we talked about. They can begin a forward-facing car seat if they're greater than 2 years of age or exceed the height recommendations for the rear-facing car seat. For safety, we want to teach toddlers stranger danger and also teach them to swim to help avoid drowning.